American Cancer Society updated its colorectal cancer screening guidelines. And what happened was that they were analyzing data that they collected on all the colorectal cancers. And what they found out was, after analyzing the data, that the incidence of finding colon cancer is getting more towards the younger age. And so they felt that if you do a screening at 45 years of age instead of 50, which was the normal one, then you can catch more precancerous polyps or an earlier cancer and therefore save more lives. So what they recommended was that average risk. Now, average risk means a person who has no problem, really. He has no family history, he has no problems, he's just a walkie-talkie guy. And that is the person they're talking about, that you should screen them at age 45. And if he does not have anything at that colonoscopy, then he needs another one in 10 years, right? So this is when they don't have anything. Now, there are different ways that they left for people to choose. One is that you can have yearly stool checks to see if there is blood in there, or there is a DNA test every 3 years on stools, or any imaging study. However, if you find anything on them, then you have to do a colonoscopy to get that thing out anyway. So what we prefer is a colonoscopy because we can visually see something. And there are certain polyps which are flat that you can only find out on the colonoscopy. So that's why, in my opinion, that is more preferable because it's a one-stop shop. You go in there, you find something, you remove it. So that's one. Now the second thing is that what about the people who have a problem? So those are the people who should be seen who should have a colonoscopy immediately, and those are what we call alarm symptoms, like somebody with rectal bleeding, somebody with change of bowel habits, somebody with weight loss, somebody with abdominal pains that you don't know why they're happening, or ulcerative colitis or Crohn's disease. There is another group, and that is the high-risk group. High-risk groups are those people who have a family history of colon cancer, who have a personal history of polyps, and a personal history of very advanced polyps. People who have ulcerative colitis and Crohn's disease. These have to be checked earlier and more frequently than the people who have nothing and are just coming here for screening. Now, they also recommended that the screening can be done up to age 75. And after age 75, you can decide after talking to the patient. Patient may say, hey, why are you discriminating against me? I'm a healthy guy, I want to live longer. And if you feel that it would benefit him, then you can, do it. But 85 is the cutoff where they do not recommend any screening at the age of 85 and more, because they think that the complications can be more than the benefits. So that is how this whole thing came about. So it's very important that this awareness gets around, that, and I hope people realize even at age 50, when the recommendation was at age 50, not everybody is getting colonoscopies, and that is why colorectal cancer is still the #2 killer in the country. So it would be a good public health service of yours that you can spread the message that not only did the American Cancer Society emphasize on screening colonoscopies, they in fact lowered the age to 45 because they got so concerned about the data they analyzed, which showed younger people getting colorectal cancer around like 40, 45.